Comprehensive strategies for preventing heart attacks and cardiac arrest in men. Heart attacks and cardiac arrest pose significant threats to men's health, impacting both longevity and quality of life. Contrary to common belief, these issues are not exclusive to older individuals, with heart disease ranking as a leading cause of death among men aged 35 to 54. Understanding heart attacks and cardiac arrest. Distinguishing between a heart attack and cardiac arrest is vital. A heart attack, or myocardial infarction, results from a plumbing problem in the heart's coronary arteries. When these arteries become clogged with fats and cholesterol, blood flow is obstructed, leading to cellular damage and potential pump failure. On the other hand, cardiac arrest is an electrical issue, characterized by irregular heartbeats, arrhythmias, that disrupt the heart's pumping rhythm. Cardiac arrest can sometimes follow a heart attack. Symptoms of a heart attack. Chest discomfort. Description: often characterized by pain, squeezing, or discomfort in the chest. Radiation: pain may radiate into the arms, shoulders, neck, or jaw. Shortness of breath. Description: difficulty in breathing or a feeling of breathlessness, accompanied by sweating and nausea. Rapid heartbeat. Description: a racing or irregular heartbeat, potentially accompanied by dizziness or nausea. Warning sign: unconsciousness can follow a rapid heartbeat. General discomfort. Description: overall feelings of unease, anxiety, or extreme fatigue. Common in men, symptoms may differ from those experienced by women, and men might dismiss discomfort as stress-related. Symptoms of cardiac arrest. Sudden loss of consciousness. Description: a person experiencing cardiac arrest may suddenly collapse and lose consciousness. No pulse or breathing. Check for the absence of a pulse and no normal breathing. No response. Description: lack of response to stimuli or attempts to wake the person. Abnormal breathing sounds. Description: gasping or abnormal breathing sounds. Immediate action: if abnormal breathing is detected, emergency assistance is essential. Differentiating between the two. While some symptoms overlap, distinguishing between a heart attack and cardiac arrest is crucial. Heart attack. Symptoms usually develop over a period, allowing some time for intervention. Chest discomfort, shortness of breath, and a rapid heartbeat are common warning signs. Cardiac arrest occurs suddenly and often without warning. The individual may collapse, lose consciousness, and stop breathing. Immediate action. Recognizing symptoms promptly is only half the battle. Taking immediate action is equally crucial. Call emergency services. In the event of suspected heart attack or cardiac arrest, call emergency services immediately. Start CPR, cardiopulmonary resuscitation. For cardiac arrest, initiating CPR can significantly increase the chances of survival until professional help arrives. Use an automated external defibrillator, AED. If available, use an AED as soon as possible for individuals experiencing cardiac arrest. Risk factors for heart attacks. Age. Risk. The risk of heart attacks increases with age, particularly after 45. Family history. Risk. A family history of heart disease can elevate the likelihood of experiencing a heart attack. Gender. Risk. Men generally face a higher risk than women, although the risk for women increases post-menopause. High blood pressure. Risk. Hypertension strains the heart and arteries, increasing the risk of a heart attack. High cholesterol. Risk. Elevated levels of LDL cholesterol contribute to the buildup of plaque in the arteries. Smoking. Risk. Smoking doubles or quadruples the risk of heart attack due to the harmful substances in tobacco. Obesity. Risk. Excess weight puts additional strain on the heart and is linked to other risk factors like diabetes. Diabetes. Risk. Diabetes increases the risk of heart disease, often in conjunction with other risk factors. Physical inactivity. Risk. Lack of regular exercise is a significant risk factor for heart attacks. Stress. Risk. Chronic stress can contribute to unhealthy lifestyle habits and impact heart health. Warning signs for heart attacks. Chest discomfort. Warning sign: uncomfortable pressure, fullness, squeezing, or pain in the center of the chest. Upper body discomfort. Warning sign: pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath. Warning sign: feeling breathless, which may occur with or without chest discomfort. Cold sweats. Warning sign: sudden sweating, often described as cold and clammy. Nausea or dizziness. Warning sign: feeling lightheaded, nauseous, or experiencing dizziness. Risk factors for cardiac arrest. Previous heart attacks. Risk: individuals with a history of heart attacks face an increased risk of cardiac arrest. Coronary artery disease. Risk: narrowing or blockage of coronary arteries contributes to cardiac arrest risk. Heart rhythm disorders. Risk: conditions like ventricular fibrillation can lead to sudden cardiac arrest. Family history of sudden cardiac arrest. Risk: a family history of sudden cardiac arrest can increase personal risk. Warning signs for cardiac arrest. Sudden loss of consciousness. Warning sign: unexpected collapse and loss of consciousness. No pulse or breathing. Warning sign: check for the absence of a pulse and no normal breathing. No response to stimuli. Warning sign: lack of response to attempts to wake the person. Preventive measures. To minimize the risk of heart attacks and cardiac arrest, it is crucial to focus on preventing the buildup of plaque in the arteries, a condition known as atherosclerosis. Adopting heart-healthy habits from an early age significantly reduces the likelihood of cardiovascular issues. Recommendations include: regular exercise, engage in at least 30 minutes of physical activity most days of the week. Healthy diet, embrace a diet low in unhealthy fats and rich in fruits and vegetables. Weight management, maintain a healthy weight to reduce strain on the cardiovascular system. Smoking cessation, quit smoking, as smokers face 2 to 4 times higher risks of developing coronary artery plaque. Stress reduction, implement strategies to manage emotional stress, a contributor to heart problems. Delaying the implementation of these changes can have detrimental effects, but studies show that positive lifestyle modifications, even in those with existing heart disease, lead to longer life expectancy. Managing risk factors for heart attacks. High blood pressure, hypertension. Lifestyle changes, adopting a heart-healthy diet rich in fruits, vegetables, and low-fat dairy, reducing sodium intake, regular exercise, and maintaining a healthy weight. Medications. Antihypertensive medications may be prescribed to control blood pressure. Diabetes. Lifestyle changes, maintaining a balanced diet, regular physical activity, and monitoring blood sugar levels. Medications. Insulin or oral medications may be prescribed to manage diabetes. High cholesterol. Lifestyle changes, adopting a low cholesterol diet, reducing saturated and trans fats, increasing soluble fiber intake, regular exercise. Medications. Statins are commonly prescribed to lower cholesterol levels and reduce the risk of heart attacks. Weight management. Lifestyle changes, embracing a healthy diet, engaging in regular physical activity, and seeking professional guidance for weight loss if necessary. Smoking cessation. Lifestyle changes, quitting smoking is one of the most effective ways to reduce heart attack risk. Support programs, enrolling in smoking cessation programs or seeking support from healthcare professionals. Regular exercise. Lifestyle changes, incorporating at least 150 minutes of moderate intensity aerobic exercise per week, along with strength training exercises. Physical activity monitoring, regularly monitoring physical activity levels and adjusting as needed. Stress reduction. Lifestyle changes, adopting stress-reducing practices such as mindfulness, meditation, yoga, or engaging in hobbies. Professional support, seeking counseling or therapy if stress levels are significantly impacting mental well-being. Medications for heart attack prevention. Aspirin. Usage, daily low-dose aspirin may be recommended for some individuals. Consultation, always consult with a healthcare professional before starting aspirin therapy due to potential side effects. Statins. Usage, prescribed to lower cholesterol levels and reduce the risk of heart attacks. Regular monitoring, regular blood tests may be necessary to monitor cholesterol levels and adjust medication as needed. PCSK9 inhibitor, evolocumab, Repatha. Usage, prescribed for individuals with cardiovascular disease to reduce the risk of heart attack or stroke. Consultation, decision on usage should be made in consultation with a healthcare provider based on individual health and risk factors. Ongoing monitoring and healthcare collaboration. Regular checkups. Frequency, schedule regular health checkups to monitor blood pressure, cholesterol levels, and overall cardiovascular health. Collaboration, maintain open communication with healthcare professionals to discuss any changes in health status and adjust interventions as needed. Individualized treatment plans. Tailoring interventions, healthcare providers will tailor treatment plans based on individual health profiles. Ensuring personalized and effective management of risk factors. Education and empowerment. Informed decision-making, Stay informed about the latest research and treatment options to make empowered decisions about personal health. Immediate emergency treatment. When symptoms of a heart attack or cardiac arrest manifest, immediate emergency treatment is critical to enhance the chances of a positive outcome. Recognizing symptoms such as chest pain, radiating discomfort, shortness of breath, and unconsciousness should prompt urgent action. Emergency medical services, EMS. Call for help. Dial emergency services immediately to ensure prompt professional assistance. Cardiopulmonary resuscitation, CPR. Immediate action. For cardiac arrest, initiating CPR can maintain blood circulation until medical help arrives. Automated external defibrillator, AED. If available, use an AED to restore normal heart rhythm. Emergency room care. Swift admission. Individuals with heart attack symptoms often require immediate admission to the emergency room for further assessment and treatment. Post-emergency treatment and ongoing interventions. Risk assessment. Evaluation. Individuals who have experienced a heart attack undergo thorough assessments to evaluate the extent of damage and identify ongoing risks. Blood thinners. Preventing clots. Anticoagulant medications may be prescribed to prevent the formation of blood clots, reducing the risk of recurrent heart attacks. Vasodilator drugs. Opening blood vessels. Medications that dilate blood vessels can be employed to reduce the workload on the heart and enhance blood flow. Stents. Restoring blood flow. Stents, small mesh tubes, may be inserted into narrowed or blocked coronary arteries to keep them open and restore blood flow. Surgical procedures. Bypass surgery. In severe cases, bypass surgery may be recommended to create new pathways for blood flow, bypassing blocked arteries. Implantable cardiac defibrillators, ICDs. Restoring rhythms. ICDs are devices implanted under the skin to monitor heart rhythms. In case of irregularities, they deliver electric shocks to restore normal rhythms. Long-term management and lifestyle changes. Medication adherence. Consistent use, following prescribed medications, such as statins and blood thinners, is crucial for ongoing heart health. Cardiac rehabilitation. Structured programs. Engaging in cardiac rehabilitation programs, including monitored exercise and education, helps individuals recover and adopt heart-healthy habits. Lifestyle modifications. Dietary changes. Adopting a heart-healthy diet, low in saturated fats and rich in fruits and vegetables. Regular exercise. Incorporating regular physical activity to enhance cardiovascular fitness. Smoking cessation. Quitting smoking to reduce further damage to the heart. Stress management. Implementing stress-reducing techniques to promote overall well-being. Regular follow-ups and monitoring. Follow-up appointments. Regular checkups. Attend scheduled follow-up appointments with healthcare providers to monitor progress and adjust treatment plans. Diagnostic tests. Monitoring markers. Periodic diagnostic tests, such as blood pressure monitoring and cholesterol checks, assist in assessing ongoing cardiovascular health. Conclusion. In conclusion, safeguarding against the threats of heart attacks and cardiac arrest requires a comprehensive and proactive approach to heart health. Contrary to misconceptions, these cardiovascular issues do not discriminate based on age, affecting men as young as 35. The significance of early intervention and adopting a heart-healthy lifestyle cannot be overstated. Understanding the distinctions between a heart attack and cardiac arrest is paramount. While a heart attack stems from a plumbing problem in the coronary arteries, cardiac arrest is an electrical issue characterized by irregular heartbeats. Prompt recognition of symptoms, whether chest discomfort, shortness of breath, or sudden loss of consciousness, is crucial for immediate action. The risk factors for these conditions, spanning age, family history, lifestyle choices, and underlying health conditions, underscore the need for preventive measures. Engaging in regular exercise, maintaining a healthy diet, managing weight, quitting smoking, and reducing stress collectively contribute to minimizing the buildup of arterial plaque. Managing risk factors requires a dual approach of lifestyle modifications and, when necessary, medication. Medications such as aspirin, statins, and PCSK9 inhibitors play a role in preventing heart attacks. Individualized treatment plans, regular checkups, and collaboration with healthcare professionals ensure a tailored and effective approach to managing risk factors. In times of emergency, immediate action is pivotal. Calling for emergency services, initiating CPR, and utilizing automated external defibrillators can make a life-saving difference. Post-emergency, ongoing interventions, from risk assessment to the use of blood thinners, vasodilator drugs, and surgical procedures, contribute to long-term management. Long-term success hinges on lifestyle changes, medication adherence, engagement in cardiac rehabilitation, and the incorporation of heart-healthy habits, including dietary adjustments and stress management, form the cornerstone of recovery and prevention. Regular follow-ups, diagnostic tests, and an empowered approach to individual health round out the continuum of care. By embracing these comprehensive strategies, men can fortify their defenses against heart attacks and cardiac arrest, paving the way for a healthier and more fulfilling life. Your health matters. Quali.health